dementia? Does anyone know what dementia is? How about I give you a clue? It's not a diagnosis. If one of you or one of your friends goes to the doctor and the doctor says, "Oh, I think you have dementia," then you need to ask your doctor, "Well, what type of dementia do I have?" And we'll get into this here in a minute. Dementia is a set of symptoms. When we say someone has dementia, we're saying they've had changes drastic enough in their life to affect their everyday living, their thinking process. That's what we say when someone has dementia. They're just, as I grew up, I heard a lot of the older, my grandmother, and even people making fun of other people who would say, "Oh, they're demented." Well, just what exactly did that mean? Sometimes when people were making fun of it, they were saying demented instead of saying crazy, or that, it was not a nice term to use. But dementia is a problem with your everyday functioning and thinking. We'll see changes in the memory, the language, the thought, the behavior, and the mood. And you will see those things happen in people who have Alzheimer's. Saying a person has dementia is like saying they have a fever. How many of you have children? How many of your children ever had fevers? Didn't you have to know what caused the fever in order to treat what was wrong? Sometimes if they have a fever, they may be flushed, their face may be red, they may be hot to touch, they may be dehydrated. We need to know what's causing the fever in order to treat it. The most common one that comes to my mind is when a child has strep throat. If you go to the doctor and you say, "My child is coughing and they're complaining about a sore throat," and all the symptoms that you're giving the doctor, that's what dementia is all those symptoms. So please try to remember that dementia is not a diagnosis, it's symptoms of something.